Great, so let's kick it off. So welcome everybody to the webinar, What's Ethics Got to Do with It, hosted by UPDWG, the UAV for Payload Delivery Working Group. My name is Kat James, and I'm the Community Manager for UPDWG, and I'm here to help facilitate an amazing webinar today about the role of ethics, safety, and security in drone-enabled healthcare logistics in Africa. So recently, the Drones Doing Good Alliance, in partnership with the Frontier Technology Hub, produced a report talking about the role of ethics in shaping drone regulations. So we're being joined today by some of the authors and the contributors of the report to learn more about their key findings. So before we get started, just a couple of housekeeping items. The webinar is going to be an hour in length. We're going to have 40 minutes for presentation and then 20 minutes for Q&A. So we're going to ask people to either hold their questions till the end or pop their questions in the chat, and either Ruth or I will call them out during the Q&A session or respond to them. And this webinar will be recorded. We'll send it out in an email to all the participants, and it will also be available on our website. So we're really hoping that today will be a really lively discussion. So you have two options to participate. You can either participate non-verbally by leaving a question in the chat, and I or Ruth will read those questions aloud. Or during the Q&A session, you can raise your hand and I will select various speakers and I will unmute you and you can ask your question to the group. Great, so without further ado, I want to introduce our panelists. So we're lucky to have two members from the Drones Doing Good Alliance, Tendai, who is the co-founder and managing director, and Hans Peter, who's the co-founder and director of technology, as well as Dumi, who is the founder and CEO of Micromech, and Rumbani, who is the chief medical engineer for the Malawi Ministry of Health, as well as the Drones for Health lead for the ministry. So now I will kick it off to Tendai to start the presentation.
Thank you so much, Kat, for that introduction. Good afternoon and good morning, everyone. We're really excited to have you all on this call. It's so nice to be here. We're particularly excited because one of the aims of our paper is to spark discussion and to get exchange going between industry experts, people who are operating drones, and those who are also thinking about starting drone operations. So I really hope you all bring your insights and experiences into the discussion section at the end of the presentation. Next slide, please. So this publication wouldn't have been possible without the time and insights of over 20 industry experts. We heard from government agencies, ministries and civil aviation authorities. We had convening partners, drone operators, both international and local, drone manufacturers, international and local. We had, of course, also important ecosystem players. So, you know, all of these experts provided such valuable insights and experiences and perspectives. And I think that's what makes this publication so valuable and also particularly worth reading. Next slide, please. So what's the paper about? It covers three topics: safety, security, and ethics. Safety is about making sure no one is harmed and no one's property is harmed by a drone. Security is ensuring that there's no ill-intentioned use of drones, or the disruption or interference of regular or good expected drone operations. And ethics is about the principles that determine the right use of the drone. And it also covers who gets to decide what that is and what is appropriate. So our paper basically brings together these three topics. It intertwines them and explores how and what we can do today to increase safe and secure operations in drone-enabled healthcare logistics. Next slide. Thanks. So the publication covers several areas. So we wanted to just give you a rough idea of what else is in the publication, because we couldn't cover everything in just this 1 hour. And so if you click one of the areas we cover in the publication, you'll see a background section that talks in general about what drones have been useful in healthcare logistics. And we also have another section, if you click, which covers some of the challenges and risks that were mentioned in our interviews and in our research. And if you click one more time, there's also a very detailed section on solutions. So we go into a great deal of solutions that can be used today, and some of them are at low cost and easy to roll out. Some of them are more complex and maybe not quite ready for now, but they are options that are coming up in the future. And so for all in the publication, it is very tangible and concrete. We don't just keep it fluffy, talking generally about ethics. And so, we want to invite everyone to, at the end, we'll drop the link for the publication, but we hope that it not only sparks general discussion, but also leads to concrete action on the ground. So for today, though, we're focusing on the ethical discussion and the ethical sections, because they are have such a fundamental impact on drone operations, and yet they're not always discussed very directly. And so we wanted to unpack some of those ethical considerations that we mentioned in the paper, and whatever the ethical positions that undermine the proposed regulations or the active regulations in the country will have a great deal of effect on the impact that drones can have, the cost of drones, and even the possibility of whether they can take place or not. So in our publication, you also see a stylized table which explains how these three factors are determined by different ethical considerations. So the first point I wanted to touch on is our guiding principles. So there are 5 guiding principles that we talk about in the publication. I'm going to talk about 3 of them for today. The first one is be proactive, start safe and small, and work your way up. As one interviewee, we'll stick on the first one for now, Kat, thanks. So as one interviewee from the Rwandan Ministry of ICT said, you'll find most regulators tend to not be open to these new technologies. They wait, for example, for international regulatory organizations to publish regulations on how drones can be monitored, controlled, and integrated. And he stressed how for Rwanda that wasn't going to be the right approach, and instead they chose the first principle to be proactive, start safe and small, and work your way up. And Rwanda has greatly benefited from that. So has actually more broadly globally, there has been great benefit of seeing that example. And so I wanted to bring in our first panelist on this point. Malawi is a country that has been very proactive, has started safe and small, and has expanded from there. It was one of the first countries to have a drone corridor. It's also currently has about 100 flights a week, and also is the home of the Africa Drone and Data Academy, which is an important source of talent for the African drone ecosystem. So Rumbani, can you tell us about that first guiding principle, be proactive, start safe and small, and why that has been important for the Malawian drone ecosystem?
Thank you very much, Tendai. So I really agree that in looking at the technology as being very new, the government through the Ministry of Health made decisions, very critical decisions, to make sure that the technology is rolling out with the concrete regard to the safety of those who are operating the technology, those who are benefiting from the technology, and also those who are participating in the technology development. So we started at a very low scale, for instance, like starting with a very few districts, Kasungu, Sanje, and Chikwawa, just 3 districts at the start. And at that particular time, very few drones were being used. The reasoning behind was that we observe how safe the operations are, and if we are indeed being able to do the correct way of transporting the products. After having seen that we are doing fine in that area, starting at that very low level, then the government decided to be scaling up to more facilities. As we are talking now, we are operating in Malawi in over 8 districts, and quite a number of hard to reach facilities. So that has been a good start, and it has given us a proper ground to look at the nitty-gritty issues that are supposed to be looked into carefully before you scale up. Agreeing with the fact that you, through our colleagues at the DCA, Director of Civil Aviation, we've been working closely together to make sure that the testings at Kasungu are properly done, and the certification of the commodities that are going to be transported is also properly done by involving all the required stakeholders. So at this point in time, we have just managed to develop the drones for health guidelines and recommendations, which is at a very advanced stage. Very soon it might be going to the senior manager of the ministry for an approval so that you can start actually using them. So those guidelines will help us to even actually be including the drone operations or incorporation of the drone operations in the health sector strategic plan 3, which is now under development. So as we are doing that, that means now we are scaling up. We are planning to scale up to all the, by 2024, we should be able to scale up to all the hard to reach facilities in the country. But we are very careful to do it systematically and slowly, making sure that we don't leave any stone unturned before we move forward. And also we have a privilege of actually getting some resources to do the RCT. I understand that the research office has already approved that, so we should also be going into that direction, which would also be able to help us to compare the impact of the drones on the health system as we move forward. I think I can. So we have 3 phases.
Great.
The first phase is where we started with just 3 districts. The second phase is where we are now. We are trying to scale to all the hard to reach facilities. And then the third stage is where now we are scaling to all the facilities, and then even actually involving now the blood transfusion hubs and the central medical stores trust hubs. Thank you for now.
Thank you so much, Rumani. I think that's a really great illustration of how that guiding principle can be applied, in the health use case area. The second guiding principle is don't cut and paste. Instead, test, refine, and develop appropriate and safe regulations. So there's a reason why European, American, and Australian companies are coming to Africa to conduct drone operations. In many ways, Africa is a leader in the space. And as one interviewee said, well over 20,000 BVLOS flights have been conducted on the continent without major incidents. So it's important that proactive countries, especially proactive African countries, be part of the conversation of developing and testing out regulations. And I wanted to bring in Dr. Hans-Peter on this particular guiding principle. Hans-Peter, you've been flying drones for close to 20 years, doing various drones for good operations in Africa, Asia, and Europe. Can you explain why we're not yet at a point where we can cut and paste anything, and we're still in a phase of testing and developing and refining?
Yeah, thanks a lot. The very important thing is that at the moment, the whole market is developing very, very much. We don't have much experience. There is a lot of new technique, something non-country, not Germany, not Japan, not America, have really very good systems already in place. And a lot of the, facts are changing by the new technologies. 5 years ago, the flight controllers had been quite bad, so they were forced quite often crash or something. Now we had more in my company, more than 5,000 flights, and we didn't have no problem ever with the flight controller anymore, or when we did this test. So it's very, very important that we are flexible to our situation where we should fly to. We should see the risk we have, and the laws which are over densely populated metropole like Berlin and an area in the Black Forest or in the desert. The risks are completely different, and so we should really very, very much be aware of the real situation where we want to operate the drone, who is operating the drones, and something like that. And I'm pretty sure in 20, 30 years, we have quite a good set of regulations. But just at the 3rd of December, the EU, they renewed all the regulations that they put out at the 1st of August, because they say, hey, it's too much strangling. We don't have no progress anymore. Yeah, and that is really very important. And a lot of the air traffic regulations came from the manned aircraft. But it's a difference with a plane with 50 tons and 100 people on board, crashes, or a 3-kilogram foam drone in a forest. Yeah. Do you think was it clear what I said? We must observe. We must know what we do,
I think,
and that's it. Yep.
Great. Thank you very much, Hans-Peter. The third principle is to inform and educate in order to better contextualize risks and unlock potential. So one of the interviewees, an international partner, an international operator rather, said that how important it is to have strong engagement and how it really pays off when things don't go as planned. And he explained that when you're communicating well and closely with the community and they see tangible benefits to the use of drone technology, they'll be more receptive and supportive when the unexpected happens, because they see tangible benefits. They see real value of drone technology. I wanted to bring in Dumi on this point. Dumi, you're an award-winning local drone operator and manufacturer. I'm curious to hear how you have applied this guiding principle in your work.
All right. Thank you so much, Tendai. So informing and educating is very important for community acceptance. As Micromech, before any drone operation, we go to the targeted communities that we want to work with. We approach the village chief, and then we share our plans on what we want to do with that community. Since 2018 to date, we have worked with about 5 communities, and we have directly gotten input from 85 community members, mainly women, and mainly women, on the challenges they face to access health care, and if drone technology can help. And some of the things that we have learned from such a collaboration and from such sharing of ideas is one thing that they are mostly hoping for is where drones can deliver directly to the communities as opposed to health centers, because their challenges say as much as drones can deliver to the health centers, there's still a distance that they have to cover. So as much as we are doing last mile, we are not very much getting to the end user. So that insight only came through by directly engaging the community. And one way we also do the informing and educating is through drone STEM education. So Micromake, as a local startup in Malawi, we work with established organizations such as the African Drone and Data Academy. For example, early this year in June, we were running a vocational drone training where we trained about 45 youths in drone technology. This will enable the youths to be informed drone operators. And we know as the youths grow, they'll be the ones to occupy decision-making organizations, decision-making roles in government organizations, in the Ministry of Health and other influential sectors. So as much as they are aware about the risks, the potential of drones, they're able to make better informed decisions on the drone sector. So it's very important to inform and educate. Thanks. Yeah, and I mean the same can also go to policymakers. Hello, you can hear me?
It seems I've lost sound. I can't hear anyone. I'm just going to dial in on my phone. Can everyone hear me?
I can hear you clearly.
Okay, great. Then I think my sound will come back in a minute while I log in on a different device. Okay, so we can go to the next slide. And we wanted to touch on some of the myths and fallacies that we came across during the interviews, and our interviewees had very interesting insights on some of the things that they said. They sound good and sound correct on the surface, but when you go deeper from an expert perspective, some of these didn't always actually make sense, or they revealed flawed logic, which wouldn't actually be in the benefit and interest of scaling operations in a safe and secure way. So one of those, I'm going to share 3 of them here. But one of them is that one death is too many, and if you ban drones, you won't have a problem. If you could click cat so we can see the more nuanced position that came from the interviews. So actually banning drones doesn't remove the risk of intentional misuse, nor does it reduce the total number of lives lost, as drones in healthcare contribute to saving lives. And so I wanted to bring in Rumbani on this point and find out from you, Rumbani. I know this is a position that you also agree with. How have you seen this more nuanced perspective play out in your operations? What has been the impact of the drone operations in Malawi?
Hello. Okay, yeah. So thank you very much. That's quite an interesting area as well, because there are arguments indeed that the drone technology maybe is expensive, etc., etc. But the one guiding principle that the Ministry of Health is taking a stand on is the fact that life is priceless. So we cannot compare saving even a single life to whatsoever cost or other issues that can actually come with it. So the understanding is that there are a number of issues that you could lead to saving a life that a drone can contribute to. One very good example, like in Malawi, is a situation where you have sites or facilities that are very far from the main hub or the district hospitals, as we call them here. So for an ambulance to go to such kind of places, it might take maybe 4 or 6 hours. you are using a drone, it only takes 30 minutes or thereabout. So the question comes in, say, okay, now we have a woman who's battling with her life. You just need some kind of specific medicine that can save her life. Do you really need to take an ambulance and travel all the way 6 hours before you reach to where this woman or this patient is, instead of just using a drone, which will take 30 minutes and you save that life? When the ambulance goes there, it is going there to pick a live human being, taking them to the nearest actually referral facility. Or you abandon the drone and leave that life to pass on or to die. So that's the kind of thinking. There are a number of actually examples that we have as a government and the Ministry of Health that we have seen an impact from the drones. Another very good example is a comparison of the existing system of transportation in terms of transporting the lab samples and lab results. The systems that we have in place now, they would take 1 week for us to receive the samples and then send back the results to the facilities. It takes 1 week. So if you are using a drone, the sample can be actually flown to the central facility within less than 1 hour or thereabout, if we want to. And then if the sample is ready, that has been done in the morning. If the sample is ready in the afternoon, the sample will be taken back to the facility in the afternoon. So within 1 day, you can have a sample tested at the laboratory and then the results being sent back. That will help our patients to get diagnosed within a shortest period of time and get the medication that they really need for them to survive. Otherwise, we've lost a lot of lives because by the time you are sending the results, the patient is seriously ill and then they die. So we think this technology is very good, despite the fact that when each and every technology is starting, there are some challenges that will come with it. But with time, those challenges are mostly ironed out and then you move smoothly. That's why we started with at a very low scale, as I said earlier on, and we're moving up to as we are scaling. So we have got a number of good examples of drones saving lives. At one point, actually, there was a patient who needed just 1 pint of blood, and the blood was transported, and that was during the floods, and the blood was transported within 20 minutes. If we were to use an ambulance and then thereafter a boat, it would have taken maybe a day before that blood reaches that particular facility. And definitely we all know that that particular patient would have lost their life, but we saved that life. So for our citizens, we really think we are joining hands as the Ministry of Health and as a government that we really want to embrace this technology because it is adding value to the systems that are already existing in the country. Thank you. Hello, did you get me?
Thank you, Rubani. Yes, we got you. Thank you for that response. And also the very specific case study on a concrete example of how a drone was used in a particular case during the flood. I want to move on to the second example of comments you might often hear in the sector. And one idea is that maximum redundancy is the best approach. And redundancy is a modern aviation concept. It's a very important one. And it involves a duplication of critical components or functions within a system with the aim of increasing reliability in the event of a failure. So it's a really important concept. Several of our interviewees pointed out, though, that it's not necessarily always the best approach. And in fact, while redundancy is a valuable safety measure, it should be used wisely to ensure it is not counterproductive. I wanted to bring in Dumi. You're a drone manufacturer. How have you seen this as an important weight, an important nuance on redundancy, and how can redundancy be counterproductive?
All right, thank you so much, Tendai. I think redundancy is a very great thing to have because it enables safety. So for example, a drone that has 4 motors could be a quad plane, 4 motors. If you give it 6 motors, you are sure of, say, if one motor fails, you can at least land on the other 5, right? So that's a good safety feature. But then when you start to add more and more redundancy systems, for example, you're adding more attitude control, could be GPS, could be airspeed, the more processing time and processing power you are requiring from the control system. The same for the batteries. So the more you add the redundancy, the more you create room for failure as well, right? So I would say it's a double-edged sword where if used correctly, it's good for safety, but then also it can be a challenge when it's requiring more output power from the system. The same way, let's say a country, before they implement a drone system, they would say, we want operators and drone manufacturers to add such and such redundancy in their systems, okay? How are we enabling, how sure are we that such redundancy systems are not becoming a hinder to local manufacturers? I could give example in telecommunications, where you need to keep your drone on site at all times. So you need to keep track of where your drone is at all times. One way of doing it is by subscribing to satellite services, right? So satellite providers can track your drone for you at a fee. But we all know that satellite tracking comes at a high cost. And that's a barrier to entry for local drone operators. So as we're bringing in redundancy systems, how sure are we, how are we keeping the balance between keeping it simple and cost effective while also not having it as a hinder? So just to repeat, it's something very, very effective, but it has to be done in the most simple way and efficient manner. I think it's over to you, Tendai.
Explanation. Adding.
Tendai, we can't hear you properly.
Can we move on to the next slide, please? Thank you very much, Dumi, for that intervention. I wanted to move on to this third one, which is about the Big Bang versus 1,000 Islands, where the Big Bang is sort of like the perfect comprehensive solution, which has everything that's required. You might think of this, for example, with the ideal UTM solution would have everything under one options that are required in one software piece, versus the 1,000 Islands, where you'd have various small solutions that are all integrated together into one system and coming from different providers. So few partners, and the nuance that came out of the various discussions was that, in fact, when you're building a modular system, brings a degree of resilience and competitiveness to systems that a single comprehensive solution cannot provide. Hans-Peter, can you weigh in on this nuance between the big bang solution versus the 1,000 island solution?
Yeah, thanks a lot. This is as well one of the myths I really have experienced in my long professional career by programming. You know, as soon as you want to set up something, you want to have everything there and the flight logs in there and the track record and something like that, which sounds very nicely. But in reality, the more complex a system is, the more it is slow, it is complex, it doesn't meet the demands you really have. And so I like much more, or in Europe or in the industry can be big, very big software projects for pension funds or healthcare. They just failed with using a lot of 100 millions of euros. And so much better is when you have these 1,000 islands, you have a specific software for a single task, but you have open interfaces that they can communicate with each other. So when one little module is not working, then the whole thing that the other parts are working as well. And as well, then you are not reliable. This is one, like big companies like Airbus or Hamburg Harbor, they develop systems and they like it very strong, very big, but then you're dependent all the life. You know, when you need a little update or something like that, there may be a new open software group which does much better things, but we can't do it there. And even when they sell it to you for a cheap price, very often they rip you off with a service rate and so on. So in my opinion, and I did really a lot of software very much, and I did so much, it's much better when you have very slim, very good software for single tasks, but you can, by sharing the data and having defined interfaces, you can there were you can put together a system. And I think good advances as well. You can start with it at the moment. With the things you have, you don't have to wait till the big universal solution, the Big Bang will be there in 5 years or something like this. Mostly it isn't. And so this is really one of the myths we must really fight against. We must really say, hey, when you have a very good flight planner, then we do it. And then when we want to integrate maybe the checklist recorder, we have another software, but when the interface is here, you can put it together in a database or a text-based module or something. This is something we must be really and then we must really be aware we should try, and when we have a small thing, we can test it. There are no the risk that there are some hidden problems is much lower than in a very complex system with a couple of 100,000 dollars of source code. That's so far.
Thank you so much, Hans-Peter. You know, we'll bring the presentation to a close here, and I hope you've gotten an idea of some of the things that we're discussing in the paper, some of the insights that are in the paper, and we'll drop a link to the publication at the end, of course. But we wanted to get into the discussion because we're also curious to hear from your perspective and your thoughts on this. And perhaps before we get started, Kat, could you perhaps do the polls we prepared so we hear from people and then we get into the discussion and hear what people think?
Yeah, definitely. I'll launch the first one. So we want to know, how much do you think that ethics has to do with safety and security in drone-enabled healthcare logistics? Seeing a lot of people think it has a lot to do with it. I think one person thinks it has a little to do with it. Wait a couple more seconds. Great, and then Tendai, do you want me to go to the second poll as well?
Yeah, sure.
Great, so on that one. So these are the results.
Before we get into the second question, I was just thinking it would be nice to hear from someone who, their perspective, why they think ethics has a lot to do with it, in what ways, just to hear from other people's experiences. So I don't know if anyone wants to raise their hand or drop a message in the chat. I see Douglas and Sonnet raise their hand. Kat, would you like to call on someone?
Yes, one moment.
Here, Kat, I can do it for you since you're sharing your screen. Yeah, we just Douglas, why don't you go ahead?
Hi, thanks very much. I hope everybody can hear me. So I'm currently in the US, but generally based in Malawi. So wherever there's, I feel wherever there is an opportunity to impact people's lives personally or to a large extent, then you can't move away from the ethics component of it. Also where there is an option for right and wrong use of drones, you can't move away from ethics. There's got to be considerations that are taken into account to ensure that things like people's privacy and people's safety and people's health is taken into account. So I think it's difficult to see how you can, we can say that there is no or little link because the potential to impact people's people and people's rights and the potential to do right and wrong exists in the use of drones. Thank you.
Thanks, Douglas. I think that's very clear and valuable input to the conversation. Let's move on to the second poll question.
So the second poll question is, what type of risks are greatest cause for concern for drone operations? And so we have drone operation risks like software or hardware failure, physical environment risks like unexpected weather conditions, enabling environment risks, telecommunications and interference, and then population risks, so lack of community acceptance. Give it 10 more seconds. And then you can see the results. And Tendai, we did want to get one question in the Q&A that I wanted to address. Somebody had a question about the one death is too many comment, referring to the risk of fatal injury from drones, which can be an understandable sentiment, but is true for other vehicles as well. So how do we compare safety concerns with drones and maybe other types of operations and other types of transportation?
Thanks for that. I didn't quite catch the exact question there.
Yeah, so the question is just how should we be thinking about, safety in terms of comparing drones to other transportation methods, and does that come up in the dialogue when you're working with governments?
Sure. I think that's an important point. We also touch on it in the publication. How the nuance that came up. It's not that we're saying we accept. If you add the nuanced version of one death is too many, maybe you can pull it up on the screen. The idea is not to say, therefore, we don't have to worry about safety. It actually means that we have to worry about, think about regulations in the most holistic way. And so it was interesting to note that different civil aviation authorities had different perspectives on what their mandate was. And so some countries see their role as a civil aviation authority in a very narrow perspective. So their role is to make sure that no one gets hurt by the drone. Whereas when we spoke to the Malawian Civil Aviation Authority, they said that their role was to make sure that no one gets hurt by a drone and that no one is hurt by them not allowing drones to be used. So that was a broader perspective on their mandate and mission. And so when we think about this point, one death is too many, we still are thinking about it either from the perspective of someone being hurt because of using a drone or because we didn't use a drone. And so safety and security remains a core issue in all perspectives. Certainly there was no interview partner who said safety is not important. It is critical, it's a high priority. And I think that was echoed across pretty much every single interview. I'm not sure if that answers your question, Douglas.
You can raise your hand, Douglas, or we can move on to another question, which is, based on, your findings of your results, if you had to point governments in a direction of like somebody wants to kind of maybe overhaul their drone regulations, where would you recommend that they start, or what should that process look like?
Yeah, maybe I'll pass this question to Dr. Hans-Peter Tam.
Yeah. What should I say for this? It's a little bit a tricky one. Can you please specify that Can you please say it again, the question?
Yeah, so I think we've had, this conversation that, you shouldn't copy paste regulations, which definitely makes sense. And we had a compelling argument for that. But if we're not copying and pasting, what are the initial steps that you would recommend, a government take?
No, sorry. Yeah, no, I got it. Copy paste. You can copy paste. It is meaningful and good for your country. But it's very much important that you have really your vision what you want to have, and what you want to do, and whether the source where you copy and paste it is exactly the same like you want to live. Yeah. So if you have a very good adapted regulation for a desert region in Namibia, you can use it for a desert region maybe somewhere else as well. But as well, you must always reflect your technical state, what you want. You must consider what it has impact on your industry, on your stakeholder, and something like that. Of course, a lot of things is copy pasting, but I just want to fight that we really have a clear concept what we do, and that we in every particular case see what it has consequences for your country in this situation. And something which is adapted for Germany very well, densely populated area where you have LTE everywhere. You can have a different set of communications than when you are somewhere in the desert where you don't have nothing. Yeah. So I only want that the regulation authorities, they must be aware of what they do. And as soon as you, for instance, have a thing which doesn't, for instance, when you're in Congo, there's a lot of water everywhere. So when you say, oh, we don't fly, we are not allowed to fly over water because in Germany, the river, in summer, there are hundreds of swimmers in there. And it's no sense. We must be always aware that the use of drones can be something very meaningful, especially in the health sector. It can even save lives. And the drones, not because we are lazy or we are not reflecting enough doing it. So I don't say copy paste, no copy paste, but you must think really exactly in all the depth what it means. Okay.
And maybe I could also just add to that point. I think that's also where you know, from the publication, the first thing to
And then your connections and
Yeah,
do
and
would be, you know, to apply guiding principle number one. So start safe and small. Uses that. The next thing you should do is to take out different regulations. You know, create context as you. Such as Rwanda and Malawi, speaking with other survey aviations, hearing from them and their experiences, I think all of those three things would give a country a really good starting point where before you're starting to cut and paste anything, you're still just getting your feet wet in a safe and contained way.
Thank you so much for that. So I think we have time for one more question. So I don't know if anybody wants to drop one in the Q&A or raise their hand. Any other questions for our panelists?
We've got one raised hand from Douglas again. So Douglas, I will turn it over to you.
Thank you. It's easier to talk than to, I can talk faster than I can type. So Ruth, thanks for your response to my query about is there information out there on the section of the myths, etc. Generally, is there material being prepared for the public? So essentially, public understanding of drone applications. Is there material that's easy to read, easy to communicate? That addresses people's concerns, because again, I see the section 3 is really more geared towards, I guess, drone operators, or maybe government can look at that. But is there simple, or is there thoughts around, and I'm sure people have done it, that are readily available, that that can be shared with the public, just to improve the public understanding of drone application? Thank you.
May I say something?
And oh yeah, please do, and can Dumi also and Rumbani answer if there's anything from a Malawi perspective. That would be interesting.
The way I like your question very much, because very often the images of drones in the media, they are either killer machines or for privacy, they are looking at our kids or women or whatever. And the German government once made 4 years ago a very big application, drones for good. And then they asked about, I think they collected more than 50 different use cases where the drones doing really very impressive thing. It's available, it's in German, but I think it should be there's a lot of application where it's good, but I think this would be a good initiative when we do it in different countries in English as well, that we just show, hey, come on, it's not this annoying noise because noise, or it's not violating our privacy, or it's not killing machines. Yeah. But if you like, I have quite a lot of literature about everything. So if you like, we can have a kind of a database where we put it in here. And this is something I really like very much when you say, Rumbani, that you shared your experience. This is so bad, because a lot of the companies don't like to publish their failures or something, because everyone can, when you ask them, we never have a crash. And I think I learned so much by my own hundreds of millions of mistakes I make in my life, and with drone operations as well. And when we can have a kind of community where we put, hey, I tried this, and it was good in theory, but this and this happened. This would be so much helpful that other groups were doing the same way.
I see Gaba also put in the chat some resources that they have on the UPDWG resource library. Could we also hear from Dumi and Rumbani from the Malawian context how they've managed to sensitize communities and if they have resources to share?
Right. Thanks, Tendai. I think I'll go first. Yeah, so from a Malawi perspective, I would say there is no concrete written material for the underground. By the underground, I mean the communities themselves, right? So whenever there is information to be shared about drone technology and its potential, it is mainly contextualized or targeted towards a specific area where the operation is being conducted at the moment. So for example, it could be in Kasungu, right? But yeah, there is indeed a need for information material which is simple and that can be shared at a wide range. And that can start within schools, both community, local-based community schools. It could be shared with farmers, the community chief, you know, and going up there. The current approach, I think it's more top down as opposed to bottom up. So I think we need more of a bottom up approach.
Okay. Thank you very much, Dumi.
Great, thanks for that, Dumi.
Can I come in now?
Yes, please, Rumbani.
Okay, thank you, Tendai. So, so far, as a Minister of Health, there is a requirement. When we are drawing up the memorandums of understanding and think of those, there is a requirement that each drone operator, when they go and do their operations, they have to sensitize the communities. And we are very serious.
Bonnie is muted.
Rumbani, can you unmute yourself?
No, maybe somebody muted me. Somebody might have muted me, but it's all right. So what I was saying is that actually, so there is a requirement that each and every operator in the health sector, as they are going to the communities to do the operations, the first and foremost and very, very important aspect of their project should be the community sensitization. And we have seen that happening. When we are just starting, we had these cases where the communities would be wondering, and there were a lot of myths about actually the drone technology. But when we actually moved towards we moved to this stage where now we are sensitizing the communities before we start the operations, I think most of the things have been resolved. So that is the strategy. That is the requirement. You sensitize the communities thoroughly well before you start the operations. Now we are thinking of engaging our colleagues because within the Ministry of Health, there is a department which we call Health Education Unit, which is actually mandated to educate the communities whenever there is a new development, etc., etc. So we would wish to engage them so that we develop actually the correct messages together, and then actually make good use of such and to all the communities within the country. Because as I told you earlier, the second phase is to make sure that all the hard to reach actually areas are being serviced, and for us to do that very well, then we need to start by giving the communities the correct information about the technology that we are bringing to them. So that's how we are moving. But for now, I can assure the team that sensitization is paramount, and no operator can go to a site and start actually operations without sensitizing the communities. The only issue is not written actually communication. This is a verbal communication that is done by inviting the communities at one place, and then you talk to them. Thank you.
Everybody, and I think Gabo wanted to end with one last comment before we close off.
Yeah, I just wanted to mention that I put a couple of resources in the chat that are from some people on this call, like Marga from Tanzania, a great study of public perceptions of use of drones there. There is one that is on the public perception of the use of drones from 4 different countries, one of which is Malawi, actually. And that the community perceptions campaign or study that happened in Malawi then informed the community sensitization that was done there quite a few years ago now, and has continued to inform the current community sensitization. And then the last tool that I shared is the Drone Evidence Generation Toolkit, which actually has focus groups questions and community sensitization and perceptions tools that you can just use and copy and paste right away that were informed from many countries that did this. So those links are all in the chat for folks that want to see those, and feel free to reach out to us and we can help you look at those more or adapt them to your context.
Great. And so with that, I think we will close. Thank you all for your engagement during this session. And thank you to our panelists. This was a really interesting conversation. I really appreciate you taking the time. If anybody has any additional questions that weren't answered, please feel free to reach out to Tendai or Ruth. And then all of the links should be in the chat, and we will be sending out this recording probably tomorrow, as well as it will be up on the website. And if anybody is not a member of UpDog and they would like to be a member, you can join via the link on our website. So I hope you all have a great rest of your day. And thank you so much. We appreciate it. Bye, everyone.
Thank you very much.